Yeah.
So they don't care what you think. They're going to do what's best for you anyway.
Well, hopefully so. And I think that a lot of things, I said this last time I was here a year ago, there's a lot of the stuff, I've been in healthcare now, I don't know, 25 years, something like that. And this isn't a universal statement, but I would say it's a 80% of the time statement. And that is that a lot of the advances in medicine, I've said this at our board meetings and stuff, because somebody will say, well, when this happens, then the cost will drop. And I look and I go, no, I've seen too many things where actually the cost goes up. Yeah. New advances in medications and just anything you can think of, all kinds of different procedures. But what it does is it extends life. It certainly changes the quality of life. We used to fix your knee, it would get, when you fix it when you're 20, but by the time you're 50, we got to fix it again because it's pretty screwed up. Well, now they have stuff where it's like, you fix the knee, probably you might ride out your life that way. And it's actually a better fix than we could do back in '72, and so on and so forth. I was doing rounds the other day. I came back from a meeting, and sometimes when I'm walking through the hospital, if I have a free hour, I just jump up, and the residents are doing rounds. And it's fun to go in like the pediatric ICU or somewhere and just hang out. And so I did. And you see some really, really, really sick kids, but it's so fun watching these super smart young people. I mean, and they care so much about the kids and what they're doing and everything. It's really a joy. But they were talking. I walked up, and they laughed afterwards. The attending, she said, oh, that was just for you. But they walked up, and they were talking about the use of a certain drug in this one little boy. And they said, if he doesn't, we're going to give it a couple more days, but if something doesn't happen, we're thinking about using this, this, and this. And I can't repeat the names. I can't remember them and all this stuff. But it was $10,000 a vial. And that was our cost. That's what Possible pays for it. And cool, it's a cool thing, too. This was not, at Packard, they don't talk about, well, that's a Medicaid kid, or this is a Blue Cross kid. It's just like, no, we're talking about, he or she will need this if we need to do so. But they said, let's give it, as was said earlier, let's give it a couple more days because this is kind of here and kind of there, and we have a little more time before we use it, because it just ups the cost so dramatically. And then some of the things also are quite toxic and dangerous. You don't want to overuse them or anything because they will kill the bug or kill something, but they'll kill a lot of the things along with it. So a lot of those advances have allowed all of us to live longer. They've allowed us to live a higher quality of life and a lot of things like that. But they haven't necessarily dropped price. The price of an outpatient knee surgery is probably the price of an inpatient knee surgery from 20 years ago. But it's a better procedure. You're up and out within a few hours and all these kinds of things. And I know because I've had 8 knee surgeries and so forth. And so there's a lot to this whole cost thing. But the advances really are helping all of us. They don't necessarily drop the price.
It's a good perspective. So let's look at changing consumption patterns among patients. Is there anything that jumps out at you in terms of larger, bigger picture patterns of patients consuming care differently or receiving care given by medical providers differently? Peter, you want to start us off?
Well, Ernie touched on this a little bit, and Tim referenced some skin in the game. So there is really no limit to how often or how frequent people will access care when it's free. And what I've noticed, at least as I think about the healthcare debate and what's going on with the Affordable Care Act, it's interesting. Americans, we love freedom, but I think we love free things even more. And when healthcare is free, we use it a lot. Who wouldn't, right? So trying to create mechanisms or schemes where individuals have skin in the game, where they're rewarded for lifestyle behavior and improvement in lifestyle behavior change. Those we think are mechanisms